Hi everyone, welcome back to EasyLiving.com and another episode on Easy Health. And this is basically a continuation of my journey to discover whether or not I've got sleep apnea. Well, over the current webisodes that you've seen, I have sleep apnea, and Dr. Kwatli from the American Hospital of Dubai has said so after doing the sleep test. So I'm here with Anas, and he's going to explain what kind of device I should be looking at and what are the elements that goes into setting up such a device on me.
First, I would like to show you our latest technology from Philips Respironics. This device is called Rimstar Auto Aflex, which is the latest technology, which we call it the 60 series. Now, this device mainly it contains the main unit, then we have the humidifier, as well we have the tube and the face mask.
So Anas, the question is, look, I've been on the internet and I've tried to search for a CPAP device. I think that's what it's called.
Yeah.
And there's no concrete information, especially about local content. So if I'm looking to get a device, I really don't know where to go.
Mainly as a CPAP, the CPAP term, it comes to continuous positive airway pressure, which it means that we are pushing air inside the airway in order to open the airway of the patient. Because normally the CPAP patients, they having like chronic diseases while their airway is partially or totally closed. So what we are doing, we are just pushing an air in order to open the airway.
Okay, so how does a patient like myself determine what is the right solution for me?
Okay, so mainly before the patient will come to know that he needs a CPAP device, he should do something, we call it a sleep study.
Yeah.
Sleep study, mainly the patients, he will do it in the hospital, so the doctor can know which type of severity, which type of sleep apnea the patient is, if he's mild patient or moderate patient or severe patient. Then after that, the doctor will do something, we call it titration test. Titration test, it's to know what's the best pressure to the patient, and based on that the doctor will recommend the patient to go to the company and choose which device is the best for him and what's the best level of pressure.
I have been through the sleep apnea test, and you can click right here, you can see the test that I went through, and Dr. Kwatli said that I have mild sleep apnea. So how many levels are there, and when we say mild, then do you determine which device or which face piece or mask would best suit me?
Now, as a sleep apnea type, this will consider to us which mainly a level of pressure we should use, not as a face mask.
Got it.
Because mainly as a masks, it's mainly for the patient comfortability. So whatever it's more comfortable for you, then you can take it and buy it.
So that's a good point. What it really determines if you have mild, medium, or severe, you will allocate a different kind of device for these patients.
Exactly.
Because that again determines the different kinds of that air push into the lungs.
Now, as a masks, we have different type of masks. We have mainly like 3 types. We have the face mask, and we have the nasal mask, and we have the nasal pillow mask. Mainly, we can differentiate it based on the patient comfortability. Usually, we ask the patient if he's breathing from his mouth during sleeping. So if the patient is opening his mouth during sleeping, then we will recommend him the face mask. Why? Because the face mask is covering nose and mouth. But in case if the patient will be using the nasal mask covering only the nose, and he's opening his mouth during sleeping, then the air will come from the nose and some part will go out from the mouth. Then we'll be having a more leak from the machine, which will reduce the benefit which we needed from this device.
That's a good point. So depending on how you breathe during the night, you would probably require either a nose mask or a full mask, which basically covers your nose and mouth. But how do we know that? I mean, who's going to tell us?
Yeah, mainly your partner.
Right, okay.
Mainly.
So your significant other will basically say, hey, look, you need the full mask. In my case, I think I'm going to need the full mask.
Yeah, I think so.
Okay, so let us see how this device works.